Hi everyone. The presentation I'll be giving today is titled Bridging the Gap for Moms with Developmental Disability, the why we should and how we can offer adequate prenatal and postpartum care for moms with developmental disabilities. So first of all, let's talk about the target population. The population will be pregnant and newly parenting moms with developmental disabilities in Franklin County. The barriers they face, pregnant women with developmental disabilities, they face unique challenges that can pose risk to both themselves and their children. With that said, there currently is a very large lack of both clinical and social services set up to meet this population's very unique needs. And the problems that they face are often compounded by the intersectionality of poverty. So just a few more statistics. We know that women living with developmental disability are more likely to be living in poverty, have chronic health conditions like heart disease, diabetes. They're more likely to face depression, to lack financial stability. And because of all of those risk factors, they're also at an increased risk for having adverse birth outcomes. So a little bit more about the connection between poverty and developmental disability. The higher prevalence of developmental disability in lower income communities is likely influenced by the poor social determinants of health that exist in these lower income neighborhoods. But especially during that perinatal period, including access to nutritious foods, lack of adequate health care, higher rates of stress, trauma, and higher rates of substance abuse. So in short, what we think is that there may be a higher prevalence of babies born with developmental disabilities because their mothers are living in communities where they have poorer access to healthcare, nutritious food, higher rates of stress, engaging in behavior like smoking and alcohol abuse. So that's one theory as to this connection between poverty and disability. So when we're looking at Ohio, according to the CDC, 26.9% of adults in Ohio have some kind of disability, whether physical or cognitive, which is just a tick higher than the national average. But Ohio does also have higher rates of people who are affected by cognitive disabilities, so things that affect their concentration, their memory, decision making, and their self-care. And then Franklin County, which is where we're really looking at. Franklin County's poverty rate was 15.9% in 2017, which was down from 17% in 2013, but still significantly higher than the national average. And very quickly, I want to talk about Franklin County's infant mortality rate, which is the number of infant deaths per every 1,000 births. Because this infant mortality rate is gives us a really good gauge at a community's well-being overall. We know that if more babies are dying in a community, that community in general is not doing very well. So when we look at the 8 lowest income neighborhoods in Franklin County, we see that their infant mortality rate is almost double the national average. And as far as the statistics we have about developmental disability in Franklin County, the percentage of people in Franklin County experiencing any kind of disability, we know that that's 11.6. However, we don't really have further delineation regarding severity of disability and whether those disabilities are intellectual or physical, etc. But again, because of the connection that we know exists between poverty and developmental disability, we can assume that the majority of people living with DD live in these low-income neighborhoods in Franklin County. And because they're living in poverty, we can assume they are high risk for lots of things. So what services are available for them? And again, this shows our 8 infant mortality hotspots or low-income neighborhoods in Franklin County. So again, what services are available? Well, when we're looking at pregnancy programs and resources available in low-income neighborhoods, there actually right now is a pretty robust network. There's Celebrate One, which which is kind of the overall initiative. There's Moms to Be, Centering, Nurse Family Partnership, Root, Teen and Pregnant. But what about programs that are available for pregnant or even just parenting moms with disabilities? There's really none. So, as you can imagine, there are lots of gaps in services for this population. For one, moms with developmental disability, they often do not have the skills to really adequately care for themselves, but even more so a baby. And because developmental disability is such a spectrum, women may be living with severe delays, but they may or may not meet criteria to even receive the disability benefits that are available that maybe aren't pregnancy related, but things like Social Security, financial support. And then we also see that the Franklin County Board of Disabilities offers services for families with children with developmental disability, but again, there are not programs for parents with developmental disabilities. And we see a lot that the research for developmental disability really doesn't extend beyond research in children. Moms with disabilities may have difficulty establishing and maintaining routine prenatal and postpartum doctor's visits. And doctors are simply just not trained to tailor their education to be understandable to people with DD. So again, these things are very likely to affect mom's pregnancy and the health of her pregnancy if she's not able to get to her doctor and establish care. And even if she is, she may not truly understand the recommendations and education from doctors. So I interviewed the director of the Moms to Be program, which is a weekly community and education-based program in Franklin County. And I interviewed the director, Twinkle Schottke, who gave me a few examples of women in her program who happen to be experiencing developmental disability. Again, this program is not specifically for women with developmental disabilities, but some participants do meet that criteria. So one mom she told me about was a 22-year-old female with developmental disability who has a 13-month-old and a 2-month-old, is homeless and not eligible for services through the Department of Disability. Regardless that she has documented disabilities, the county does not feel she meets eligibility requirements for more in-depth services. Twinkle reports that this mother has faced a mountain of legal challenges that she's unable to navigate on her own, and she's often worried about the health and well-being of the woman's children, despite knowing that this mom really genuinely loves and wants the best for her kids. The current system we live in does not support her in doing this adequately. One other mother in her program who's experiencing extreme food insecurity and weight loss very late in her pregnancy does receive the financial benefits of Social Security, however, rarely actually gets it herself, as her stepmother is legally in charge of her funds and often does not give the money to her. Twinkle discussed worrying about this mother's eventual birth outcomes, considering she's losing weight late in her pregnancy, and the emotional stability of this mom who's going to soon be a parent. These are just two of many current moms experiencing developmental delays in the Moms to Be program who have nowhere else to go. And again, Moms to Be is not designed to support this population. So here's our proposal, a new program that would be called Bridging the Gap. It would be modeled after Dr. Pat Gaddy's Moms to Be program, in that it would be both group-based education and one-on-one case management. It would be made up of an interdisciplinary staff, that is medical professionals who would mostly be nurses and licensed clinical social workers. So it would be a very holistic approach to care, and it would be better continuity of care because of this, because the staff would be able to manage both their emotional and clinical health. So who would be eligible for this? Really any pregnant or parenting mother living with developmental disability in Franklin County. It would be a 2-hour program. So the first hour would be group creativity activity that would be designed to foster friendships and relationships among the peers. And then the second half, participants would meet with their care advocate, which would be, again, a nurse or social worker who is responsible for providing ongoing weekly case management and emotional support. These care advocates have the ability to refer to partner programs for further support from either doctors, child development specialists, dietitians, or whatever referral is needed. So in summary, by providing these care advocates to our moms specialized in both clinical care and mental health, this program will be able to improve the participants' overall care to ensure that both her prenatal medical needs are being met, as well as her postpartum and perhaps more importantly, her emotional needs. Because our mental and physical health are inextricably connected, this dynamic team will be able to offer a more holistic form of care and will work to close the gaps in services these community members typically encounter. The care advocate will act not only as a medical professional, but as an advocate for the participants' care from other agencies as well. With consent from participants and or guardians, the care advocate will be able to communicate with other healthcare providers involved in our participants' care to assist in communication between program participants and their whole healthcare team. So the difference between these care advocates and your traditional case managers and other programs is, number one, their specialization, their certifications in mental health and clinical care. But also these care advocates are meant to have smaller caseloads so that they can really provide the intention that moms with these disabilities really need. And lastly, here's just a view of the logic model that kind of sums up how the program operations would begin, what barriers we would address, and the outcomes that we anticipate to see. Thank you so much for your participation in this and your time. And please email me with any questions. Thanks so much.